Empathy is one of the most important characteristics of a nurse. A patient's ability to communicate their needs and preferences is essential to providing quality care. But sometimes patients don't know how to communicate these things or may not feel comfortable doing so. So it falls on the nurse to listen empathetically, communicate effectively, and advocate for the patient when needed. Nurses often work with patients who are experiencing some of the most vulnerable moments in their lives. Illness, injury, and hospitalization can be scary and overwhelming for patients and families, which is why it's so important for nurses to provide compassionate and empathetic care. When nurses listen empathetically and communicate effectively, they can help patients feel heard, valued, and respected, which can lead to improved patient outcomes and satisfaction. So let's talk about empathy in nursing. What is it? Why is it important? And how can nurses cultivate empathy in their practice? Empathy is the ability to understand and share the feelings of another person. It's the ability to put yourself in someone else's shoes and see things from their perspective. For nurses, empathy is essential because it allows them to connect with their patients on a human level and provide compassionate care. Nurses who are empathetic are better able to understand the unique needs of each patient and tailor their care accordingly. They're also better able to communicate with patients and families, which leads to improved patient outcomes and satisfaction. There are three key components of empathy: perspective taking, emotional understanding, and compassionate action. Perspective taking involves seeing things from the patient's point of view and understanding their feelings and reactions. Emotional understanding involves being aware of your own emotions and how they might be affecting the patient. Compassionate action involves taking steps to help the patient, such as providing additional resources or advocating for their needs. Here are a few ways that nurses can show empathy in their practice. Active listening. One of the best ways for nurses to show empathy is by actively listening to their patients. This means giving the patient your full attention, making eye contact, and asking follow-up questions. It also means being mindful of your body language and tone of voice, as patients can pick up on nonverbal cues. When nurses actively listen to their patients, they show them that they value their input and that they're there to help. This can help patients feel heard and respected, which can lead to improved communication and trust between the nurse and the patient. Understanding. Another way for nurses to show empathy is by putting themselves in the patient's shoes. This means considering what it would be like to experience the patient's illness or injury and to be in the patient's situation. This can help nurses to better understand the patient's feelings and reactions, and it can help them to provide more compassionate care. For example, a nurse who is caring for a patient with a new diagnosis of cancer might take some time to consider what it would be like to receive that news. The nurse might also try to imagine the patient's fears and concerns moving forward. By taking this approach, the nurse is better able to provide sensitive and compassionate care. Emotional intelligence. In addition to understanding the patient's perspective, it is also important nurses to be aware of their own emotions and how those emotions may be affecting the patient. This is known as emotional intelligence. Patients can pick up on a nurse's emotions, even if the nurse is trying to hide them. It's important for nurses to be aware of this and to manage their emotions accordingly. For example, if a nurse is feeling frustrated with a patient, it's important to take a step back and calm down before interacting with the patient. Otherwise, the patient may pick up on the nurse's negative emotions and feel rejected or misunderstood. Empathy is an essential component of nursing. When nurses listen empathetically and communicate effectively with patients, they can help patients feel heard, valued, and respected, which can lead to improved patient outcomes and satisfaction. If you're a nurse, take some time to reflect on how you can show empathy in your practice. And if you're a patient, remember that your nurse is there to help you. By communicating your needs and feelings openly, you can help your nurse provide the best possible care. Thanks for watching. If you enjoyed this video, please give it a thumbs up and share it with your friends. Don't forget to subscribe for more videos like this one. Have a great day.